Hello, and welcome to the final part of our series, Implementing Simplify My Meds. By this point, you have identified your patient, synchronized their medications, called the patient, filled the medications, and now it's finally time for the patient to pick up their prescriptions. You've now streamlined your operations to make the patient's time in the pharmacy as valuable as possible. We encourage the pharmacist to take a few minutes to sit down with the patient. Hello, Mrs. Smith. How are you today?
I'm fine, Wendy, and how are you?
I'm doing wonderful. Thanks for asking. Can you believe this gorgeous weather we're having?
I know. I'm looking forward to getting out into my garden. It's so gorgeous today.
Well, we'll have you back in your garden in no time, but Kevin, our Simplify My Meds program manager, made a note here that you didn't need your metformin medication, your diabetes medication this month. Is that correct?
Yeah, well, I stopped taking it a couple of weeks ago. I read somewhere that it makes your stomach ache, and I don't like feeling sick.
Sure, that's understandable. This medication can cause some stomach upset, especially when someone first starts to take it or when their dose increases. You've been on the same dose for several years though. Was it giving you any trouble?
No, not at the time.
So we probably wouldn't expect it to. Metformin is very important because it helps control your blood sugar. Do you think you could start taking it again?
Yeah, I don't like it when my blood sugar gets too high. It makes me feel bad.
Okay, well, if you'll give me a minute, I'll get that together for you. We have all your other medications together, and you'll be back in your garden in no time.
That'll be fine.
Did you have any other questions for me today?
Not at this time.
Okay, well, if you think of any, feel free to give us a call here at the pharmacy.
Thank you.
Thank you. You might also consider having a callback file or basket available to keep track of any refills that are not picked up on their assigned refill date. These patients will need to be called and reminded to pick up their prescriptions. That's all it takes to implement Simplify My Meds in your pharmacy. For more information on any of NCPA's adherence activities, including Simplify My Meds, please visit www.ncpanet.org/adherence. Here, you will find all the customizable forms talked about today, as well as the Pharmacy Operations Manual that offers step-by-step instructions for implementing Simplify My Meds. Thank you for joining us, and good luck implementing.